Even if you have a patient that decides to bleach their teeth after the composite has been placed, it will chameleon off of that new bleach shade, where it wasn't quite possible before with the pigmented type of composite, because we would always tell the patient, hey, you better bleach your teeth if you want your composite restorations to match. So this is a great feature of this material. So there's really three things in tooth anatomy that we need to focus on: primary, secondary, and tertiary anatomy. So let's go over those one by one briefly. Primary anatomy is basically just the line angles, what you see there in the red. But what is very important, we need to know where they are. So whenever I do composites, because I get to decide where the line angles go, I need to first identify them. I need to visualize them. So whenever I do a restoration, I always use pencil in this case to identify the line angles. And basically, you just rub on the side of the restoration and the line angles will identify itself. Now, if they're in the right place, we're golden. If they're not, we can visualize it so that we can move them to the right place. And when the line angles are in the right place, like in this left central incisor, the tooth looks right. Secondary anatomy is basically depressions. You see the red areas. Those are depressions on the tooth, and they vary because, again, humans are variable. Some teeth are texture, some are not. So if they're there, we're going to put them back where they need to be. And the way I do that is simple. This is the only burr I use to create secondary anatomy. And you can see me marking the areas. This is the Typodon I'm going to be using. You can see that it's very texture, and that's why I wanted to pick this Typodon. You can see it's very texture. And I will draw in pencil where I want the depressions to go, or the secondary anatomy, and then I place it with the burr. So once we've done that, it's created with a burr, I need to soften those areas. Because it's too mechanical. So the way I do it, I use these things called contours or coarse anatomy trimmers. Tertiary anatomy comes in the form of pericomata. You can see that on the picture with the red lines. So some teeth have it and some don't. So that's basically the preparation. We're replacing a large class 4 in the left central incisor. There's my line angles. I'm trying to emulate the left central to the right central. And you'll notice this patient has a lot of notches and a lot of secondary anatomy and some tertiary anatomy too. But with this process that I've just described, you can achieve this very easily. Just follow the workflow. And this is immediate post-op. You could still see the tissues a little irritated from my retraction cord. But I want to notice the anatomy is really nice. It blends perfectly with the contralateral tooth. And there you go. And we can even recreate the notches there. So we only treated the left central to emulate the right central.